Well, Ken, it's good having you as always. I think we'll get a bunch of people have a bunch of questions in here. For you guys that aren't aware of Dr. Berry, then you got to crawl out from underneath your rock. He's been doing the keto thing for quite a while. He's got a large audience on YouTube. I think close to 1 million of them following him now on that, and has been a warrior for this sort of nutritional approach for quite some time now. And for the good guys in the fight against we're against the evil empire. I guess we're the rebel. They've got I don't know if who's Emperor Palpatine for the Star Wars thing. Maybe Bill Gates. All right, guys. Well, I'm gonna like I said, I think everybody's on mute, so I will relay your questions as per usual. Ken, welcome to our little MeatRx community, which is I'm glad to see growing quite rapidly. Let me get to the chat here. So we've got some people, prayers for Nashville. I don't know what's going on in Nashville. There's something.
Yeah, we had a huge tornado, and it was actually on the other side of town. So contrary to what normally happens to me and Nisha, we were actually spared during the disaster, and that's unusual for us. We're not used to that. But yeah, the other side of Nashville looks like a hurricane hit it. It was a huge tornado that persisted for 50 miles, which is very uncommon. Usually they touch down for a minute and then they're gone. But this thing persisted, and it looks like matchsticks laying in East Nashville. It's really terrible. So thank you for that.
Okay, yeah. Well, like I said, we're just going to wait for a few questions to come in here. You guys don't be shy with your questions. That's what we're here for.
Can't be shy. I don't allow that.
Yeah, exactly. Okay, we do have a question from Tracy. It says, do I need to eat bone meal and collagen supplements if I'm eating all meat? I guess by eating the bone meal and collagen supplements, it causes constipation. Ken, do you want to comment on that? I've got some thoughts, but go ahead, Ken.
Yeah, I think that you can get all the collagen you need from eating specific cuts of meat. I happen to really like sardines and anchovies, and when you eat those, you're eating the entire fish. You're eating the bones, the cartilage. You're eating all of the collagen that's in that thing. When you eat the membrane that's on the back of beef ribs or pork ribs, that's a pure building material for collagen. Inside of a boiled egg, there's a little membrane. Most people pull that off and throw it away. That's also pure collagen building materials. And so I don't really think there's any need for any of us to be taking a protein supplement, a branched chain amino acid supplement, or a collagen supplement. Now, if you're eating the standard American diet, you probably need a collagen supplement and a bunch of other supplements too. But on carnivore or fatty meat heavy keto, I don't think there's any need for that. That's just wasted money that you could be using to buy more ribeye. If you eat the gristle, when we eat chicken wings and chicken legs, I always chew the cartilage off the end of the bone, and that used to really gross me out. But now I do. I love it. And now Nisha, this petite little woman, is starting to gnaw the cartilage off the end of the bones. And I mean, I find that incredibly sexy. I see you smiling, Baker. But I mean, that's how we're supposed to eat meat. We're not supposed to just eat the lean red meat and that's it. We're supposed to gnaw on that bone, and that's where collagen's at.
Yeah, I think one of the things about the constipation, if you take a lot of calcium supplements, like a lot of people that have GERD, they'll take these things like calcium carbonate, and that's very constipating. So I don't know if that excess concentrated calcium is leading that. I suspect it is. And then also, if you look at steak, and there's these little fascial planes in there, that's all collagen as well. Meat, even muscle meat, is 3% collagen by volume. And again, like Ken said, the average American's getting almost none in their diet because we eat such a small amount of meat. So I don't think it's a big issue. And I know that's a little bit.
And if I can, Shawn, let me talk about constipation for a minute, but in 20 years of practice as a family doc, I saw a lot of constipation. And I want to talk with everybody about what constipation actually is and why some people think they have it on carnivore, but they really don't. So constipation, the definition of that is not pooping. That's not what constipation is. When you're eating the standard American diet full of fiber and other crap, you might shit 3, 4, 5 times a day. That's not healthy. That's not normal. That's not ancestrally appropriate. When you're eating fatty meat, heavy keto, or carnivore, you're going to poop less because everything you're eating, you're able to assimilate and absorb and break down and actually use. And so you're not eating a bunch of roughage that you can't use, and you're not eating a bunch of crap that your body has to move through and get out of you quickly. And so it's very common for someone eating fatty meat, heavy keto, or carnivore to poop a lot less. That is not constipation. And I hear people call that constipation. They're like, oh, I'm constipated on carnivore. But when I ask them to describe what they mean by that, they say, well, I used to poop 3 times a day, and now I'm only pooping every other day. I'm constipated. And my answer is, no, you're not. That's normal. Constipation means you have pain with defecation, with pooping. You have pain, you have bleeding, you have straining, you have cramping. That's constipation, okay? And so if you're pooping every 3rd day, which is what Beckett does because he's on a carnivore diet, and if you've ever seen a formula-fed baby that's being fed rice and corn and soy, it looks like they're going to pop an aneurysm when they poop. They poop 3 or 4 times a day, and they literally are going to poop, okay? Breastfed babies poop every 2nd or every 3rd or even every 4th day, and they literally, it just slides out. They don't even have to try. That's how carnivore poops. If we were in the wild, we couldn't be pooping 3 ginormous shits a day that stunk up the entire jungle but that would not be advantageous to us, right? Carnivores typically poop a very small volume. It's usually maybe once a day, but usually every other or every 3rd day. It doesn't have nearly the smell. You don't fart as much. And when you do fart, most people don't smell it because it doesn't stink because there's not rotting vegetables in your gut. Does that make sense?
Well, it makes sense to me, Ken. I'm just thinking, like my dogs, it's kind of like funny. They'll go and I mean, it's like 2 seconds and they're done. I mean, you're thinking about
right.
it. An animal in the wild, you don't have time to be sitting there 5 minutes stuck
right.
in a spot because you get eaten.
Yeah, you don't have time to sit there for an hour and read a bunch of research like Dr. Greger does. When a carnivore poops, it's down and done. That's it. You're done.
Interesting. Brett Lloyd's asking, hey, Dr. Berry, what's the most unexpected benefit you personally experience on a carnivore diet? Or, yeah.
Hey, Brett, good to see you, man. Yeah, I love your journey. I'm watching you on Instagram and other places. So before I was keto, when I was just paleo and low carb and primal and all that, I still had severe heartburn reflux every day, Shawn. When the Nexium drug rep came to the office, I got the Nexium samples. They didn't get given to the patients. I used to take 2 Nexium a day every single day to keep my severe heartburn at bay. Knowing what I know now, I would never do that again. But on keto, my heartburn got about 80% better, which was, if you've ever had severe heartburn, that's a big deal. And I still would have to take a Tums once or twice a week, but it was no more Nexium, and I was really happy with that. But I thought I was just stuck with reflux. But after my first month of carnivore, as I did it just as a challenge on my Facebook page, at the end of that month, I thought, you know what? I haven't had heartburn a single time this month. That's really weird. And so I decided to do a 2nd month of carnivore, still considering at that time a hack or a biohack or just a shortcut, whatever. But at the end of the 2nd and 3rd and 4th month, I still hadn't had any heartburn, which was a little bit miraculous for me. And I didn't expect that to happen. And I was very glad it did. And now I'm 14 months into carnivore, and I haven't taken a single anything for heartburn in that 14 months. I don't have heartburn ever anymore, which is amazing.
I've seen that reported many, many times. This is this is kind of a direct topic on this. Barbara A. Becker says, I've been having heartburn eating only beef, salt, and water. Any suggestions? And I guess my question would be, how long have you been on the diet? And so on.
Give it time.
Yeah.
Give it time. And if you keep having heartburn symptoms after 3 months of carnivore, then you need to go see your doctor, because, and I hope that's okay with me saying that, Shawn, I'm definitely not of the undoctored mindset. I think sometimes you need to see a doctor, and I think sometimes doctors serve very useful purposes. So you could have something called a hiatal hernia, which basically, if you drink water and breathe air, you're going to have heartburn. And sometimes if it's bad enough, you have to have that fixed. Sometimes you can have sphincter dysfunction. Your lower esophageal sphincter, just for whatever reason, nerve damage or whatever, becomes incompetent. And no matter what diet you eat, you're still going to have heartburn symptoms. And so I'd give carnivore, and I would also be very mindful of rubs and sauces and spices, because for some people, that's what they're reacting to with the heartburn. I might try a month of just beef and butter and water, and do that for a month if your heartburn's severe enough. And if you've had severe heartburn, you know anything's worth getting rid of the heartburn. But after a month of that, if you're still having heartburn, I'd go see my doctor and maybe go see a gastroenterologist for a scope.
Yeah, I agree. Yeah, that hiatal hernia, it makes it difficult because it's you've got this mechanical problem that diet
Right.
maybe change. All right, here's another common question that says, what do I tell my doctor when he says I need to start a statin? And, you know, there's no context with this, but what is a good response? I guess you'd have
you tell your doctor no. Okay, now with that being said, there's and Shawn and I have talked about this multiple times. The research showing that a statin benefits you in any way is just ridiculously ignorant research. It's done. Most of it's funded by the drug companies, and what little of it that wasn't really doesn't show much of a benefit at all. I think if you take a statin daily for 20 years, you might get 3 extra days of life or something like that on average. It's not worth the copay. It's not worth the side effects. So if your health insurance and your situation is where you can just say, yeah, doc, I'm not going to take that. I'll take some red yeast rice if you want me to, which also is worthless. I've talked about that before too, but maybe that'll shut your doctor up, right? So you can continue having a relationship with that doctor if you're kind of stuck with that doctor. But some people, like people in the military, you know, Shawn, they don't have a choice. If you don't feel that medication and you don't take that medication, you can get in trouble. And so some people have to do other things. And so there's several other methods. You can fill the prescription, then not take the medicine. There's lots of little strategies, but I would continue each time you go see your doctor to have a conversation with your doctor and to maybe have a research paper printed out every time you go saying, look at this. This is a huge study, and it was actually controlled, and they didn't even publish it for about 2 decades because the guy thought he'd get in trouble if he published it. But it showed there's no benefit at all of limiting saturated fat. Here's another study that shows I don't really care about getting 3 extra days of life. If my muscles are going to hurt and I'm going to have fatigue and low testosterone for 20 years, I don't really want that. Also, don't statins raise my blood sugar? That's bad, right? And so I think if you continue to have that conversation with your doctor and you continue to get healthier every time you go see your doctor, at some point your doctor's just going to shut up about the statin.
When there's another topic, Ken, salt. How much they're confused about how much salt to use. Do you have any kind of hard and fast rules, or how do you?
I do. I have a very hard and fast rule. If the salt tastes good, then eat it. You are hardwired to crave the things that you need for life. Okay, and so if I came to your house right now and put my hand over your nose and mouth, after about 45 seconds, you would be craving air, and you would do virtually anything to get that air, including stabbing me between my 7th and 8th rib and dropping my lung. Same goes for water. If you don't drink water for 2 or 3 days, you literally crave it like a drug. That's normal. That's your body telling you what you need. We have salt receptors on our tongue, and if you limited all salt for 2 or 3 days, you would crave salt like a drug. And so my recommendation is to salt to taste. Mammals are salty animals. All mammals love salt. They'll literally, are you a hunter, Shawn? I don't know if you get out and hunt much, but one of the ways that hunters attract deer to come close to their deer stand is to put a 50-pound salt block from Redmond's under their stand, and deer, and it's not. And so my wife Nisha, her dad Pedro is a big deer hunter and turkey hunter, and so we've got 3 acres here in Nashville, and he put a salt block back out back, and in just a month, on his game camera we've seen skunks, possums, rabbits, coyotes, foxes, obviously deer, and a bobcat come and lick the salt block. Now, they're not licking that salt block because they're stupid or because they're gluttons. they're licking that. It's like a jackpot for them. They're like, boom, I can get all the salt I need just by licking this. And we're salty mammals too. And so salt to taste. If something doesn't taste salty enough, put more salt. If it tastes too salty, put less salt next time. That's how you know how much salt to use.
Awesome. What else we've got? We got Lloyd Hardman asking about specific things with regard to low carb diets for migraine sufferers. Can you comment on potential benefits?
Oh yeah.
The keto.
So as I said before, for 20 years I practiced family medicine. So migraines I probably saw 3 or 4 cases every single day of my practice, and I never had anybody one time come to me and say, hey, since I've been eating these Weight Watchers frozen dinners, I don't have migraines anymore. Never heard that a single time. Didn't hear it with Jenny Craig. Didn't hear it with any of the other diets. But when I started recommending keto, I started getting feedback. Since I've been eating this fatty meat keto that you told me about, I used to have a migraine every week or once a month or twice a month, and I haven't had a migraine in 3 months or 6 months. Is that part of this diet? And when I first heard that question, I thought, there's no way a diet does that, right? And so I would say, no, I don't know, I guess. I don't know. You're lucky, I guess. But now I've heard from enough thousand case reports, enough thousand N equals 1, that I'm confident in saying that if you eat a fatty meat heavy keto or a fatty meat carnivore diet, you are going to have fewer migraines. And I think part of the reason is your insulin level returns to low normal. Levels of inflammation in your brain return to low normal, and your hormone profile, your thyroid hormones, your adrenal hormones, and your gender hormones all return at least closer to normal, if not normal. And hormones, as any woman knows, are intimately related with migraine headaches. And so anything that you can do to move your hormones in the right direction is going to decrease the severity of migraines and also decrease the frequency, which is a huge win for a migraineur because migraines suck.
All right, this is from Karen Orr. She says she started keto in 2019 in November. In December, her joint pain went away. Then on carnivore in January, but recently her joint pain in her knee has returned. She says, I'm not eating any nightshades, but could it be dairy? Do you have any thoughts?
Could be, yeah. And I'll tell you, I love cheese and I love heavy cream, but I did a dairy-free month of carnivore and I lost 6 extra pounds, and I think most of that was inflammation and retained fluid. But my joints felt even better without dairy, and I can tell every time, Shawn, I get too happy with the cheese or too happy with the heavy cream, my belly will start to pooch out in my right knee, which I blew out an ACL dunking a basketball back in the days, and that knee will start to tweak on me if I eat too much cheese or put too much heavy cream in my coffee. So unfortunately, as much as I love cheese, it has to be an occasional treat for me on carnivore. It seems like some people can eat as much cheese as they want on carnivore and they do just fine, but I have to limit it because I love being able to get out in my gym and play some basketball, and I love being able to do some deadlifts and squats without that knee tweaking on me. And keeping dairy very low is what helps me do that. So yeah, I would say it's probably the dairy. Keeping in mind that we're all getting older, right? And so if you've been doing keto for 3 years and you're like, oh, I'm doing carnivore now, oh, my knee hurt a little bit. Well, maybe you just tweaked your knee. Maybe you've got some arthritis in that knee that you're just going to have some pain off and on from. Neither Shawn nor I is saying that keto or carnivore are magic. We're not saying that. And we're also not saying, and I have to say this because sometimes it seems like magic, the results you get, but we're still humans and we're still, we still going to have problems. And so, but it's probably the dairy. But if it continues, go see your doctor.
All right, we got one from Becky, and this is kind of an overall topic. It says, can you speak to those that think they need to restrict their food and fat versus eating more animal-based nutrition with regards to healing and losing weight?
Yeah, I've never seen an animal in the wild restrict their portion size or count their calories. They don't do it, and because they don't need to do it. And that's kind of an artificial societal construct that we've come up with. And I think it is all tied into the puritanical beliefs that humans are by definition bad, sinful, and we need to work hard to overcome our sins, and we need to pray fervently not that I'm anti-religious, but when it comes to diet and nutrition and health, these things are physiological. These things are biochemical. They're not ethical or moral questions. So you have to get the judgment out of there, first of all. And that's where I was on another live earlier. Most women, when they start it, if you call it the carnivore diet, immediately they'll start to restrict their portion size. Just because you said the D word, right? They'll start to say, oh, I need to eat just a 4-ounce portion of ribeye. I need to cut off all the fat. No, it's hardwired, and it's usually women, because most men, if you say you can eat as much meat as they want, they go, hot damn, I'll see you later, I'm going to get a ribeye. But a lot of women, if you say do the carnivore diet, just that word triggers all these subconscious and unconscious fears and insecurities, and they immediately start to restrict their portion size. Portion size is meaningless, in my opinion. Calorie counting is meaningless. You need to eat as much fatty meat as you can eat until you're comfortably stuffed, and then stop eating. That is the carnivore way.
All right, Ken, there's a question somebody's asking, organ meats, nose to tail, is it completely necessary or not?
I don't think it's completely necessary, but I do believe it's probably optimal to include some organ meats in your diet. And my good friend, a good friend of both of ours, Paul Saladino, he feels like it's a requirement. And I think ancestrally, our ancestors did eat a lot of organ meat. They ate a lot of connective tissue. They ate a lot of the offal that we currently find gross in modern society. I'm a big fan of liver, and I'm a big fan of heart, because they're not gross. I can eat them, and heart especially. I really, really enjoy venison heart and turkey heart and chicken heart. And I think you get a ton of nutrition in there. I don't know if there's any nutrition that you don't get just from eating fatty meat, but I think that it's a little extra insurance for most people that you're getting all the vitamins and minerals you need. Does that make sense?
Well, it makes sense to me. Hopefully it does to the person asking. Here's Zach saying that I'm currently working to become a health coach, and my ultimate dream is to see the disease management system displaced with a health optimization system. That's why doctors such as yourselves are my heroes. What would you say is the primary area to focus on in slaying this giant for someone like me? Educating on health, spreading awareness of corruption, dispelling lies about the environment. My focus now is getting into the most optimal health that I can. Story.
I think that all of your effort needs to be on helping people be healthier. I applaud Nina Teichholz and the Nutrition Coalition for trying to change the dietary guidelines and trying to make changes at the federal government level, but I don't think that's ever going to work. What's going to work is a grassroots movement of literally hundreds of thousands of people reversing their obesity, reversing their type 2 diabetes, reversing their fatty liver. And basically, you're just going to have enough voices and enough voters and such a groundswell of this movement that the other method is just going to look ignorant. And people are just going to start to, just like the American Heart Association has backed slowly and quietly away from saying that dietary cholesterol is bad for you. They never say that anymore, even though individual cardiologists might say it. The American Heart Association never says that anymore because they know that's bullshit, right? And so I think as more and more of us get healthy, because you can't argue with somebody like Brett who has literally transformed their entire life. Nobody can argue with that. You know, somebody like Lane Norton can say, well, bullshit, it was just calorie restriction or whatever. But after you've got 100,000 Bretts running around America, you can't argue with that. That's just too much anecdotal information. And the federal government, the AHA, the ADA, they're all going to start to back away from the stupid bullshit advice they've been giving people. That's how we're going to change the world, in my opinion. And if you can tell from my YouTube channel, my Facebook, that's where I spend all of my effort, is talking to regular people. Very seldom do I waste my time trying to change a doctor's mind or trying to talk to the American Academy of Family Physicians and say, hey, let me be a speaker. That's a waste of time. I'm going to help people get healthier and then help them help their family get healthier. That's how I'm going to change the world. And that's, in my opinion, where you're going to do the most good and have the most effect.
Yeah, I've got a similar sort of mission, and that's kind of what this MeatRx platform is. We're doing that. And as you look around, it's just a bunch of normal, everyday people in here listening. But hey, here's a sort of a follow-up topic on that. As a doctor advocating carnivore, are you worried about being targeted for not giving dietary advice that goes with mainstream nutritional dogma? Or any concern with being targeted? Or I mean, I know you've had your home burned down, your office burned down. So your thoughts on that too.
Yeah, there is some concern, but I'm a lot like Shawn in the respect that if I know something's right and you come at me and you try to make me not say that out loud, that's not going to be in your best interest. And I think you can tell from the clinic fire and the house fire, which were both deemed by the Tennessee Board of Fire Investigation to be undetermined cause, which means they didn't find any evidence of accelerants or anything. Nisha and I both quietly think there's probably somebody who's really, really good at arson was paid to do that. So I'm like the farmer's duck. I literally don't give a fuck. If I know what I'm saying is right and that offends you or that hurts your profit margin, I don't give a damn. Come at me. Please make me the next Gary Noakes or the next Tim Noakes or Gary Fetke. Please make me that. Come at me. And so it wouldn't surprise me at all if I got a call from the Tennessee Medical Board tomorrow. I've tussled with them many times in the past about things like this. It wouldn't surprise me at all if they said, oh, we've received an anonymous complaint that you told somebody's grandmother to eat lots of bacon and she's 98 years old and she died. And so now we're going to investigate you for, poor medical practice or whatever, not adhering to standard of care, not recommending the AHA diet to her. That wouldn't surprise me a bit. And I would welcome that. And I would document every second of that on my social media. And so I would actually flip that and use that against them and probably would come out being able to help even more people when that was finished. So that is absolutely a concern, but it's not something I'm afraid of. It's actually something I would welcome. I would actually thank the investigator and pat him on the back for coming to see me.
Yeah, and I think one of the things that sort of provides some degree of comfort is we've got now not just guys like you and me and, people that are kind of, in the medical field in the forefront, but we've got thousands and thousands of people that all have social media account. And as this grows horizontally, you can't shut up a million mosquitoes. I mean, we're like a swarm of mosquitoes. They can't get us all. And so I think it's.
Yep. And I'll tell you, since the case is closed, I actually had a complaint about a year and a half ago now, Shawn. And I just said the complaint. There was some elderly lady that was coming to see me, and she said, when I eat keto, I feel so much better. And I'm like, honey, keep eating your bacon. And so one of her daughters, she told her daughter that. And the woman was literally in her late 90s, and she passed away eventually. Of course, she's 98. She's going to die. And so the daughter filed a complaint with the state medical board that I was giving bad nutrition advice. And this little nurse investigator came to the office, and I sat upstairs with her and answered questions for about 2 hours. And I think that the medical board probably did the research and said, you know what, we probably ought not to poke this snake. And so they dismissed the charge, which is, Shawn knows very well, just because a charge is frivolous does not mean the state board will not hammer it home and give you sanctions or reprimands or fines or whatever. But they said it was just frivolous and they dismissed it. But I think it was 100% because of my social media presence. I think if I'd just been a little lone doctor in the woods with no Twitter and no Facebook, they would have probably nailed me for that, as they've tried to nail me in the past. But they dismissed it. And I was blown away and very sad. I'd actually already contacted Dr. Noakes and Dr. Fetke and told them about it. They were all excited. We were all sitting on go, getting ready to make me the American Tim Noakes, right? But then the damn board dismissed it. And I was very disappointed.
All right, here's a question about CAC scans. Do coronary artery calcium scans lead to unnecessary cardiac surgery?
I haven't really seen that in my experience. I've seen a lot of hesitance on the part of cardiologists wanting to order them, even though it's in the AHA guidelines now. Have you noticed that, Shawn? People are getting extra stents or bypasses because they got a CAC. I haven't noticed that at all.
No, I don't.
And I'll tell you guys both I and Dr. Adam Nally, who's keto out in Arizona, we've seen hundreds of people lower their CAC score. And so just remember, the CAC score is a snapshot of what you got right now at this instant. After another year of keto, fatty meat, heavy keto, or carnivore, you can lower that CAC score. I've seen it in hundreds of people now that Dr. Nally has shared with me. I saw it in scores of people in my practice. And then he's been checking CACs evidently for 5 or 6 years. And he's got just hundreds of cases where people have lowered their CAC score with fatty meat, heavy keto, or carnivore.
Yeah, it'd be nice to get some of those written up, at least a case report or two in the literature.
Yeah, I know. I love that. I'd love that. And he's got so many cases, if he just take the time to write them up, that even though they're case studies, you know as well as I do, a case series of 10 or 20 or 30 patients, if that's written up properly, that can be pretty powerful in the medical literature.
Yeah. And Ken, I don't know if you're aware, there is a big carnivore study coming out. I don't know if you heard me talking about it.
I did, yeah.
Yeah, that'll be dropping, I think, in a few weeks. We'll start rolling data on that. All right, Carnivore Artist asks, is there any room for fruit or vegetables or a cyclical carnivore type diet?
If you want to gain fat for the winter, then you should eat the cyclical diet that you hear talked about by other authorities, because I think that's why our ancestors gorged on ripe fruit and berries in the late summer, early fall, is so they could gain 5 or 10 pounds so they didn't starve to death in the winter. Bears do that as well. They gorge. They actually become very insulin resistant in the fall so they can put on as much fat as possible so that when they're hibernating, they don't starve to death. They've got that stored energy. But do I think that's optimal for our health? I don't. I don't see any research that makes me think that, or any paleoanthropological evidence that makes me think that. If you want to have some occasional veg or fruit or whatever and call that what it is, a treat, I mean, it's your life. Do whatever you want. I do that about once a year when I go to Nisha's Puerto Rican relative's house in San Antonio. I'm going to have to eat some mofongo, and I'm going to have to eat some surujitos and some other, the Puerto Rican shit. But no way am I going to justify that and say, well, I'm cyclically no. Eat your meat, and if you want to have some veg, call it what it is, a treat. Call it dessert, and know that's what it is. It's not anything that you need for optimal health.
Yeah, I don't really consider vegetables a treat regardless, so I mean.
I don't either, but some people evidently do. If you want some broccoli as a treat, man, I don't understand, but have at it, but it needs to be a rare treat.
Yeah. So somebody's asking, this question, and anyway, can bone-on-bone cartilage loss grow back?
I've actually seen it multiple times. Have you ever seen it happen, Shawn?
I can't recall. I mean, it's hard to really, X-rays can be a little bit misleading depending on the function of the joint. I mean, you see this ad in the airplane magazines where they show this, knee. I don't know if you ever seen that, and it's like before and after, and it's just they just change the angle of flexion a little bit, so it's a little.
Exactly, yeah. So, several times I've seen it with. I used to do prolotherapy in my practice, and so I would do PRP, which is plasma-rich or platelet-rich plasma, or prolotherapy injections, and actually putting stem cells in the knee. I had X-rays before the fire of like a knee, and it's the same X-ray tech, same position, same degree of flexion, 3 years apart, and they've actually got another millimeter or two of cartilage in the joint. So I think definitely diet's going to help, definitely. But if you are bone on bone, if you're considering having a knee replacement, I would definitely Google prolotherapy and find a doc in your area who does PRP prolotherapy, and I would try that for 3 to 6 months before, and in addition to eating carnivore, before I had my knee chopped out. I would try that as a last resort.
Awesome. Okay, somebody's asking about bioidentical hormones in menopause. Is that okay?
Yeah. It depends. It depends. If your symptoms of menopause are not bad, if they don't affect you much, then it's not worth the trouble. But if you're having severe hot flushes and night sweats and no sex drive whatsoever, and you're having fat in the middle, even though you're carnivore, then I would definitely recommend you go see somebody who does bioidentical hormones. I did them for 15 years in my practice, and I never, ever had a bad outcome. I never had anybody have cancer from it. And I know that's all case reports and anecdotal, but I'm just telling you, all the research that showed that hormone replacement therapy caused cancer, which it does, no doubt, was done with patented fake estrogen or patented fake progesterone. And so if a doctor is optimizing your hormone levels with bioidentical hormones, I've never seen any research that shows that increases your risk of cancer. And it doesn't make sense physiologically that would increase your risk of cancer if you're putting back the actual testosterone molecule and the actual progesterone. The analogy would be, go back and think back in time to when you were a senior in high school. How many of your buddies had prostate cancer? None of them. How many of your girlfriends had breast cancer? None of them. But their hormone levels were sky high, right? And so it doesn't make any sense if you're replacing those hormones and putting it back to physiological levels with bioidentical hormones. That should not increase your risk of cancer. It makes no sense. But using fake hormones absolutely increase your risk of breast cancer and other female cancers and lung cancer and blood clots. If you're taking hormone pills, that's not healthy, and I don't recommend it at all.
All right, here's another little change of gears. Somebody 4 months carnivore, seeing Dr. Paul Mason, who guys will be coming on here in the near future as well. But she said they had some labs, everything looked good except ferritin was up a bit. It was up to 469 from 389. And then also states that their fecal calprotectin went from 79 down to 7. So that's an improvement. Any thoughts on hemochromatosis, carnivore diet, and iron issues?
Yeah, I think either you have the genetic predisposition to develop hemochromatosis or you don't. If you don't have that genetic defect, I don't think you can eat enough fatty meat. I think you could just drink gallons of pure blood a day and you're not going to develop hemochromatosis. But if you do have that genetic defect, then you might be you're definitely at increased risk of hemochromatosis regardless of your diet. And every single patient I ever saw in my practice with hemochromatosis was eating a plant-based crap garbage diet. Every single one of them. They weren't eating much meat at all. So I can't see the physiological mechanism of eating lots of meat is going to increase your risk of hemochromatosis. I don't think that happens that way. What do you think, Doc?
Yeah, I mean, I've looked into this quite a bit, and I think, if we look at iron absorption, it's regulated by a hormone called hepcidin, which is produced in the liver, and hepcidin is influenced by insulin. And when insulin levels are high, hepcidin allows increased uptake of iron. And so I think, the number you have, again, this is, even though it's, a difference of about 80 or so, I think that's still probably normal, very, very fluctuation. I think over time, you'll see that go down as you continue to improve your metabolic health. I think iron overload is just a consequence of poor metabolic health. And when you're metabolically healthy, we don't store iron.
I totally agree. I think it's just like gout and just like kidney stones. It's all about your insulin level. It has nothing to do with the purines or with the iron you're eating in your diet.
Yeah, I've got a whole bunch of comments here. I'm just trying to find the next question in here. Give me just a second. Have you ever seen chicken eggs trigger an autoimmune reaction, whereas duck eggs do not? I guess that's
possible. Theoretically, that's definitely possible because there's a different protein amino acid profile or a different protein profile in different eggs. I've found that I don't know if I've ever found a single instance where if somebody was allergic to eggs, I would tell them, I want you to try to eat just the yolks and not the white. Without exception, they come back and say, oh, yeah, I can eat a dozen yolks a day. It doesn't bother me a bit. But if I eat the white, and if I cook it like, completely, or if I eat it raw, that bothers me. It's different for different people. But it's quite possible that you could eat duck eggs or goose eggs or, bluebird eggs, and you'd be just fine. It may be one of the particular proteins that are in chicken eggs.
All right, here's another question that often comes up, and at risk of being labeled as a Cargill shill. What are your thoughts on
check this much from Cargill?
I'm still waiting, man. I'm waiting. I'm hoping. I'm holding out. I'm hoping they're going to send me all that big cash because I could really use it. But let me ask about your thoughts on grass-fed, grain-fed. Big difference. Is it necessary to do the grass-fed?
I think there is. I think that grass-fed, grass-finished, no hormone, no antibiotic beef is probably 1 to 3% better for you than the cheapest 5-pound stick of ground beef you can buy at China Mart. With that being said, and I'm assuming that we're in the circle of trust here. I can badmouth Frankie Tufano and it's going to be okay. But Frank sells $22 a pound ribeye. So of course he's going to tell you that anything less quality than that is going to kill you, right? But my question is, because a lot of the people that listen to me, Shawn, are very low on the socioeconomic level. I mean, they work in 2 jobs and their wife's got a job just to cover the mortgage. Like they're at risk of losing everything. If somebody loses a job, they're going to lose everything. They cannot afford Frankie's $22 a pound ribeye. They can't. So what am I to tell them to do? Well, fuck it. Just go eat some Lucky Charms then because they're cheap. You can buy a 5-pound bag of them. No, the cheapest meat that you can buy at Save-A-Lot or Cash Savers or Walmart is still 1,000 times better for you than the processed carbohydrate garbage. I don't think there's any argument about that. The cheapest beef you can buy is going to have more nutrition, more vitamins and minerals, more magical zoo nutrients, which is actually a thing, whereas phytonutrients is a myth. I think zoo nutrients are a real thing. I think there's nutrition in meat we haven't discovered yet. So eat the best meat you can afford. And so if you can afford to get a butcher box, get that. That's great. But if you can't afford that, don't think you can't do carnivore or fatty meat keto. You absolutely can do good keto, good carnivore, and have good results with hot dogs and Spam and potted meat. And that big 5-pound stick of ground beef that looks like a huge stick of bologna. You can do fine with that, okay? Is it 1% better to get Frankie's meat? Well, probably. But is it worth $22 a pound? Hell no.
Yeah, very good. Nancy Huplo is asking, can you use a carnivore diet to help get off, I'm assuming, biological medications for autoimmune symptoms?
Maybe. Definitely keep seeing your doctor for that condition. But I have had multiple people in my practice before the fire and then reach out to me online and say, I used to be on this injectable, this infusion for Sjogren's or for lupus or for MS. And now that I've been fatty, and it's usually the higher meat consumption percentages. So I call it fatty meat carnivore or keto or carnivore. They're like, I've been feeling so good. I didn't go for my infusion this month. I mean, is that terrible? And I'm like, as long as you're feeling good, as long as your numbers are good, as long as everything's going good, I think that's fine. I notice people with autoimmune conditions across the board, when they're eating fatty meat, heavy keto, or carnivore, they have fewer flare-ups of their autoimmune condition. And when they do have a flare-up, it's way less severe. And so for many of them, that means they can get off that ungodly expensive biological infusion they're having to go to the metropolitan city and do once a month. They don't have to do that anymore. And for some people, that's a huge savings. And so I'm not saying it's going to cure the autoimmune condition. Probably after a certain number of years, that it's not reversible, not curable, but it is manageable, and your diet matters greatly as far as how often you flare and how severe the flares are.
Yeah, I'll just echo. I've seen a number of patients and people that have done, come off those meds and seem to be able to stay off them for long periods of time. So I think there is some definite benefit. Let me see. Somebody wanted to thank you for the COVID-19 information. Are you going to be doing any more updates on the coronavirus stuff? I don't know.
Well, I probably not, but I'll probably not, because both of those videos got demonetized by YouTube, and I really feel like that my entire channel got dinged a little bit because of them, because my views have been down quite a bit since I did those. And I'm happy I did those videos. I'm proud I did them, because that information needs to be out there. But I'll give you a resource of somebody who's making an update that's very rational, very science-based. And if you'll just go to YouTube and search for Peak Prosperity, the guy's name is Chris Martinson, and he trained as a PhD level pathologist, but now he does financial stuff. But when this hit, he's a prepper, and he's all about buying gold and silver and being ready for the end of the world. But he's very knowledgeable about this coronavirus, and everything he says on his videos I agree with. So I'm probably not going to make any more because YouTube's still spanking me financially for making those two. But I do think I'm really, really tempted, Shawn, to tweet the following. I'm going to tweet at YouTube and say, since Chris Martenson and I were both 100% right about everything we said about the coronavirus, and the World Health Organization was wrong about almost everything they said, is there any way you could give me back my monetization I lost? And then secondly, could you put a link to my videos under the World Health Organization's videos so people could click there and get the real truth? But Nisha has vetoed that plan, says that's ignorant not to do that, so I probably won't. But Chris Martenson at Peak Prosperity has great coronavirus information about how to rationally prepare, not hoard and not panic, rationally prepare.
Yeah, it's kind of funny. I had a video also. I touched on the coronavirus. I basically just showed a study that just came out, and it's basically in the study, a peer-reviewed study that said eating meat has compounds that protect you from infectious disease, including the coronavirus. I read that, yep. And then I linked to some other studies on carnosine and infectious diseases, all scientifically linked. And that was demonetized. Yep. Like they don't want you to, if you say cancer in your video, if you say coronavirus in your video, they demonetize you, which I think is
absolutely
ridiculous. All right, Leah's asking about thoughts of the toxicity of a keto diet with green veggies versus something like white rice. Which is worse, which is better? Are they both bad? What are your thoughts?
Well, I think from a metabolic standpoint, rice and potatoes and bread and corn, those things are going to be more fattening. Right. So if we're just talking about gaining or losing fat, then the starchy carbs I think they're always going to be worse at making you gain fat or prevent you from losing fat. But if what we're talking about is autoimmune and what we're talking about is inflammation, then that's where every vegetable, no matter how dark green it is or how multicolorful it is, it becomes suspect. And so it depends on what exactly you're going for. If you're just morbidly obese and you don't have any autoimmunity, then that's why keto works for so many people. They cut out all the starchy grains and tubers and sugar, and they don't seem to react to the dark green veg. And so they seem to do great on keto. Others of us, like Michaela, and like I'm finding out I immediately start to bloat and gain inflammation if I eat even organic, non-GMO, hand-picked broccoli. I couldn't tell that back when I was keto because that level of inflammation was baseline daily for me. So I couldn't tell the difference whether I did or didn't. But now that I've been carnivore for 14 months, if Nisha made cauliflower rice and put a really good quality cheese sauce on top of that, and I ate as much of that as I used to eat, I would gain 3 pounds overnight. And that's not fat. That's just inflammation and retained fluid. And so, but I couldn't tell that on keto, but I can tell it now.
All right. So somebody's asking about iodine and iodine drops. Are you still, what are your thoughts on iodine? Do you used to recommend iodine drops depending on diet?
Yeah. Iodine is an absolute required mineral. There's no ifs, ands, or buts. And what a lot of the healthcare providers out there don't realize is there's something called the sodium iodine symporter that's on every single cell in the human body, from your brain to your toenail. They have sodium iodine symporters. And in one of my YouTube iodine videos, I actually linked to the research. And obviously, we haven't checked every single human tissue, but every tissue we've ever checked, there is a sodium iodine symporter. And Shawn knows the human body doesn't make ATP requiring symporters unless that cell needs whatever it's transporting inside the cell. So yeah, iodine is absolutely essential for human life. If I were able to reach inside your body and pull out all the iodine, you'd be dead within minutes, if not an hour. Okay, so you can't at all say, "Oh, don't even think about iodine. It's not important." I disagree with that 100%. I think for the majority of our time, we live near shores, near oceans, and so that's the best source of iodine is to eat seafood, to eat fish, crustaceans, mollusks. You're going to get a ton of iodine when you do that. I would prefer you get iodine in your diet and not have to take a supplement whatsoever. But for many people, they just don't get enough iodine. And so I do recommend using 1 or 2 drops a day of Lugol's 2% solution. And so that's about 1.5 milligrams of iodine, or 1,500 micrograms, which is way more than the USDA or the RDI. But it's not nearly the amount that Dr. Brownstein, he recommends 50 milligrams a day for most people. I don't think that's necessary. And you guys may have seen Dr. Saladino's video where he was talking about that. And he's talking about the Brownstein method. And neither he nor I recommend that you take 20, 30, 40 milligrams a day of iodine in the form of a pill. I think that's way too much. I'm not convinced it's dangerous, but I think it's just unnecessary. But making sure you get a half milligram or 1 milligram a day, I think is probably optimal. And that's where I see people who are stalled on their fat loss. When they add that 750 micrograms or 1,000 micrograms a day of iodine, their weight loss kicks back up again. And I think a lot of people are terribly deficient and terribly depleted in their iodine stores, and it is an essential element for function.
Yeah, just to for people that are interested, there's about somewhere between 10 and 15 micrograms, what is the iodine? Micrograms per, I want to say 3 ounces of beef. So just to put it in there.
You do get a little iodine and now here's the thing, iodine's an element, right? It's not a vitamin. It's not an amino acid or a fatty acid. No, you can't create it. It's either there or it's not there. And so if you've got a cow that's eating grass from soil that's iodine depleted, then that cow will have no iodine in the meat. Does that make sense? The cows can't create iodine. They don't do fusion or fission. They only just turn grass into magical ribeye, but they can't create elements. And so if the soil is depleted in iodine, there's not going to be any iodine in that steak. And that's the problem, is that a lot of our soils are more and more depleted. And so there should be iodine in the beef. And if the cow's eating grass that comes from iodine-rich soil near the coastline, they know, yeah, that's a good source. But if they're eating grass in Iowa, there might not be any iodine in the soil at all. Therefore, the cow's not going to have any iodine in it.
Yeah, and I think maybe some of these people that still run hypothyroid, maybe it's an iodine issue, perhaps.
Yeah, 100%. And that's why it's not going to hurt anybody to use 1 drop a day of Lugol's 2%, not 5%. That's too much. 1 drop a day is going to give you 1 milligram or 1,000 micrograms of iodine. If you take too much iodine, you just pee it out. It does not cause Hashimoto's. It does not cause hyperthyroidism. None of that stuff is true. But what Dr. Saladino was talking about was the ultra high level, like Dr. Brownstein, who I think is right about a great many things, but he recommends 50 milligrams a day, which would be 50,000 micrograms a day. And I think that's probably too much and unnecessary.
Yeah, I would agree with that. All right, this might be the last topic we have time to discuss. Unfortunately, there's still another 120 comments that I get to. Sorry, guys. Thoughts on the MTHR mutation, homocysteine levels on carnivore, and to supplement with methylfolate or not?
I think it does matter, but I think now I don't think it matters as much as I once thought it mattered. If you do get your MTHFR and you do have the mutation, if you get it checked and you have the mutation, is it going to hurt you a bit if you take a methylated B complex once a day for the rest of your life? I don't think it's going to hurt you a bit. It's inexpensive. It's not, it's not going to harm you, and it's not going to break the bank. So is it good insurance just to take that once a day? Yeah, probably. Is it necessary? I don't know. I think probably the jury's still out on that. I think you get tons of B vitamins that are ultimately absorbable and assimilatable from eating lots of meat. I mean, meat is full of all the B vitamins, and I think that our body is very good at using the B vitamins it finds in meat. I don't think a supplement is necessary. What do you think about that, Doc?
Well, I mean, first of all, I've not seen elevated homocysteine levels be often the case, you know. So I think that's something that I'm not seeing that frequently.
Yeah, and that tends to get better because I've seen people with elevated homocysteine, and I would diagnose them with an occult B12 deficiency. And then if they have the MTHR, I'd be like, oh, you need to take methylated B12, right? But every single one of those people, when they started eating fatty meat, keto, or carnivore, their homocysteine went back to normal. So was the homocysteine an acute phase reactant, or was there really an occult B12 deficiency, but then they were able to get the B12 that they needed from eating all the extra meat? I don't know. So that's why I'm still equivocal about it a little bit, and I'm not going to yell at anybody if they take a methylated B complex supplement, but it's probably not necessary.
Yeah, I think that's the one problem we have with looking at these sort of biomarkers, and we associate them with one sort of situation, but we have to realize they can be elevated or decreased for various reasons. It's not always because of we have a B12 deficiency or a gene abnormality. It may be, like you said, an acute phase reactant that's secondary to our metabolic, poor health. And then when that those things all normalize. And that's why a lot of people have been doing this for a long time. They say, don't even bother messing with labs. So you're like 6 months in until you've had some time to sort of reach a homeostatic level. But
and there's a lot of gurus out there in our space who talking about all these gene defects. And Dr. Ben Lynch has got a book out, and it's a thought-provoking book, but so many people are spending thousands of dollars getting all of their DNA sequenced, and he's like, oh, you've got this error here, so you need to take this supplement. Oh, by the way, I sell that supplement, and so I think it immediately becomes it smells of bullshit, when somebody's saying, oh, you've got all these defects in your DNA, but I just happen to have a supplement that's going to help you with that. I don't know, I don't know.
Yeah, I'm of the thing. We're all one species, and we pretty much have the same requirements. And if these things would have been, if we would have required supplements to that, these guys would have been extinct a long time ago.
Exactly, and I'd say it's a very sexy theory that we're all different and we all have unique dietary needs, and there's no one diet for everyone. That's a very seductive concept, and it almost hits some of the common sense levers, and you're like, yeah, that does make sense. We're all different. I don't look like Shawn, so why should I eat the same diet as Shawn? But I think in reality, that's all pretty much bullshit. I think we're the same species, and we ate the same thing. And there were, 100,000 years ago when they killed one of the megafauna, the husband didn't run down to the equator real quick from Siberia and get his wife a pineapple because she needed the bromelain. I don't think that happened. I think she ate the fatty meat too, and she did just fine.
Yeah, I think so. And it's like we have zebras with 41 stripes versus 42 stripes need a different diet. Doesn't happen.
Right.
Ken, thank you so much. We got to go. I got to hop on another podcast. Thanks everybody for listening in and asking questions. And Ken, hopefully we'll get you back here sometime and thank you for what you're doing, and keep doing what you're doing. And we're going to support what you do. And like I said, we'll all come together. And like I said, it's a grassroots thing, but we're getting stronger every day. I see it.
I love it, man. And I'm going to call Cargill and see if we can't get those checks.
Yeah. Let them know. Let them know they're overdue. I'm overdue about 3 or 4 years on mine, man.
Will do, brother. All right. I'll see you guys next time.
All right. Take care, guys. See you guys tomorrow. Take care. Bye-bye.